Country Director of the Health Finance and Governance Project of the United States Agency for International Development. And this is no other person than Dr. Gafar Alawade, who is here seated behind us. You see, he's one of the champions of BHCPF, not just BHCPF in Nigeria, but also the establishment of state social health insurance schemes. When we told him, look, we would like you to come here for this. Oh, of course, I know when USAID, after you have worked with the USAID project, you know the way they will take care of you. And he said, here, we don't have anything here, but I know him as someone that will come and give service, even at no charge to anybody. So please, let us again appreciate Dr. Gafar Alawade. He's here. We were in the flight together from Abuja on Sunday. He came purposely for this program, and he was going back also. And I wish you, sir, as you go back, journey mercies. And that which you have been doing, I pray that you will see the fruits of all your efforts on basic healthcare provision fund, on establishment of a functional social health insurance schemes in all the states, and you see the impact on the people, and you will sit down and you say, I contributed to the health of these people. Thank you very much. God bless you.
Thank you for the second round, the Executive Secretary. I want to call on the General Manager NTO Osogbo, Mr. Wahid Amusa, for his goodwill message to the conference. You're welcome, sir.
Good morning, everybody. Yes, I'm going to give the shortest speech, and I can assure you, because all what I will have taken time to say has been said, especially the message passed by the member House of Osun State House of Assembly. He has actually sent a message down to the erudite scholars that will present papers here today to be as much as to be simple as much as possible, so that the message can go far. So that would have been a message to pass, and so that these young ones can catch the importance of today. Yes, let me use this opportunity to appreciate the organizers of these events. This is my first time here to witness this, and I have seen it as a very laudable event to attend, and that is why I am here. I want to thank you and wish you well in all your future endeavors. Now, I want to really appreciate you for inviting the journalists here, and to assure you that this event will go far beyond Osun State by the special grace of God. I want to assure you that as I stand here to speak to you today, NTA Osogbo is watched in every part of Osun State and part of Oyo State and Kwara State as of today. So you can be rest assured that whatever it is that is done here today will go very far. So thank you very much.
Thank you, sir, for being a man of his word. He gave a very brief goodwill message. Thank you once again. We want to call on the President, Environmental Officer, Association of Nigeria, Osun State, in person of Sanitarian Tokwe Akewumi. Sir, you're welcome for your goodwill message. Please, he has encouraged his people to come here en masse today. Please give him another round of applause.
The Vice Chancellor, ably represented by the Registrar. Let me say, the day we met with the Vice Chancellor, personally, I was happy with Papa. Please, my appreciation goes to him. The chairman of today, Baba, Professor Omisa King. The co-chair, Honorable Prince Ajibola Akinloye. I specifically want to thank you because I sent message to you, I think on Friday, that you will be invited to co-chair this occasion. And you came at the right time. I want to appreciate you. You behave like a civil servant, not like a politician, to have come at the right time. Permit me to sit on the existing protocol. I am representing environmental health officers in the state of Osun. Let me first of all appreciate the organizers of this program. And I must mention particularly the chairman, Professor Ojo, for his tireless effort in bringing this conference yearly. This is the 4th edition, and this is my 3rd attendance. Please put hands together for Professor Ojo. I actually appreciate you. I actually appreciate you. It's given me a great pleasure to give a goodwill message at this particular conference, the 4th edition of Living Science Foundation. Specifically, I want to appreciate the leadership. I am part of the program. The bright and the beautiful ideas which you have all seen today, and which has actually stimulated all of us in coming together as professionals. And reasonably, we are satisfied with the progress and the attitudinal change in the public. As much as this conference or this particular organization is non-profit oriented, it has propagated a lot, especially to my group, the environmental health. And you all agree with me that environmental health, which is the control of all those factors in man's physical environment, which all may exercise the deleterious effect on his survival, has actually helped in the area of public health. As we all know that our environment is like a computer. Whatever you garbage into the environment, it's garbage out to you. And I want to say that this year theme, which is environment nutrition, is a very important aspect of public health. And when we are talking of public health, which is a science that stands on a triple stand, that is to prevent diseases, which we stand for, to prolong life, which is our duty, and to promote human health. And I want to say, with due respect to other professionals, that the health of one man is the health of all. Sanita, sanitatis. And it is particularly important for us to know, as Yoruba will say, that ilera loro, that health is wealth. And the precious asset of a man is good health. I want to encourage all of us to take our environment as our life, because the health of an individual can affect the health of all. I am of opinion that this 2-day conference, in which scholars will present papers, and just like somebody mentioned, that we should come down to the level of everybody, will actually help all of us in assessing our health and appreciate what health is. Somebody just mentioned yesterday that they no longer see environmental health officers in the streets, the wole-woles. Yes, the best global practice is not to intimidate people in the town. The best global practice is not to winch on people like they do in the olden days. Remember, in the olden days, the fear of wole wole is the beginning of wisdom. But then they coerce people, they intimidate people. The politician, not like Honorable Ajibola Akinloye, they use wole wole to threaten the opposition. Those are the gone days. Now we embrace the best global practice. You may not see me in uniform, but I am doing my lawful duty. Once again, I want to appreciate the organizers. I want to wish all of us an impactful and fruitful deliberations. Thank you. God bless all of us.
Thank you, sir, for your message. We just, while the program was ongoing, the Director, National Environmental Standards and Regulation Enforcement Agency, Southwest Zone, the person of Mr. Ismail Adeleke Ajani, walked in, and you, sir, you are welcome to give your goodwill message. Please give him a warm round of applause. He came all the way from Ibadan this morning. You're welcome, sir.
We give glory to the Almighty God. For today, I want to appreciate the Vice Chancellor, the Redeemer University, ably represented by the Registrar, the Chairman of this occasion, the keynote speaker, other dignitaries on the high table, ladies and gentlemen, friends of the environment. NESTIA is an agency of the Federal Ministry of Environment charged with the responsibility of enforcing all environmental laws, policies, protocols, conventions, regulations to which Nigeria is signatory. And we have the mandate to prohibit all processes and operations that undermine the environmental quality. And we have been part of the Living Science Foundation right from its inception. And we are proud to belong to this organization that has been imparting human life through environmental education, awareness creation, and through a lot of publications on environmental research and development. Now, the agency has been able to develop a total of 34 national environmental regulations that touch on all operations that impact on the environment. Because we believe in the agency that environment is our life. And it is whatever we give to the environment that the government will give back to us. That is why we, in our guidelines, in our procedure for ensuring environmental compliance, we collaborate, we network, we liaise with communities and even regulated communities to give us information on environmental hotspots. What are areas of environmental hotspots? These are areas of environmental violation, serious environmental degradation that we need to report and address immediately before it will degenerate into disaster that will affect the environment, that will affect the quality of life. And we are all mindful of this. Most of the cases that are being reported in the hospitals are environmentally related cases, cases of environmental toxicity, and that we don't need to spend a lot of hard-earned money, revenue of the government to tackle if we actually imbibe the culture of prevention is better than cure. And that is why I'm appreciating the Living Science Foundation in collaboration with the Redeemer University for the theme of this year's fourth national conference, which is managing the environment nutrition nexus in having optimal health. We cannot have sustainable development if the populace is not healthy, if the environment is degraded, if there is serious pollution. So we at the agency, we address environmental complaints on areas of violation within 24 hours because we don't want it to degenerate into serious public health and environmental health. On this note, I want to appreciate the organizers of this program, and I also want to assure the organizers that of next year's continued and unflinching support for the organization to ensure that environment is sanitized, that human health is not in jeopardy. On this note, I wish all of us a fruitful deliberation. Thank you. God bless you all.
Thank you very much, sir. We want to appreciate all our speakers. We have in our midst the immediate past chairman of the Academic Staff Union of Universities, OAU branch, Dr. Caleb Aborishade, popularly known as Brother Caleb. You are welcome. Thank you for coming, sir. Now, we have been talking about the young ones who are in our midst, and we are very excited to have them here. Like we said, they have been here since yesterday, listening to lectures and participating in quiz competition. I want to call on the coordinator of the program, that's Dr. Oladimeji Babatunde. He's going to give us background information about this annual quiz competition, and he's also going to announce the winners of this year's competition. Can we put our hands together?
Thank you, the moderator, and distinguished ladies and gentlemen. The Living Science Foundation runs an awareness campaign program for secondary school students to sensitize the ones we see as the frontier of the next generation about the environment and health issues, so that we can make them aware and awake to some of the issues as they grow up. And our idea is to expose them to the practices and the policies, that are available, and then to instigate ideas in them so that when they get to the hems of affairs, they know what to do. That is the idea. It's a Catch Them Young program. It's a Catch Them Young scheme. And we've been on it. We visit schools. We teach them, about the environmental issues and how they affect human life. It's been ongoing, and last year we decided that we want to start showcasing some of our activities. And what we decided to do is to establish a mini camp thing, and then bring the students from all over. Last year we had 7 schools represented, and this year we were able to increase it to 10. And with them since since yesterday evening, they've been with us. They went through 2 hours of class facilitation, and then they had very rigorous and keenly contested quiz competition. Permit me to invite the chairman. Yes, I'm calling you. Now, the 10 schools represented have been mentioned earlier. So that we can constrict time, permit me to invite the chairman of the occasion, the chairman of this session, Professor Ademola Omishakin, to please have the singular honor to present the certificate of participation to all the schools that participated in this year's quiz competition. As I call the school's name, they will step forward with their representatives, the 2 students and the teacher, and then the professor will present you with the certificate of participation before I expose to us the winner of the competition. You're welcome, sir. A round of applause for Professor. Number 1 on the list is Moremi High School from Obafemi Awolowo University, Ile-Ife. Represented by Awowoyin Timileyin and Ogunleye Damlola. Their chaperone is Mrs. Agumbiade Dio. On
behalf of the National Conference on Environment and Health, the 4th edition, This is a certificate presented to you.
A round of applause, please. Second on the list is Redeemers University Staff Secondary School, represented by Adebowale David Chiemeka Avina, and their teacher is Mrs. Ayeboyin Dio. Please let Elisha Government High School get ready.
On behalf of Living Science Foundation, Ilefe, National Conference on Environment and Health, the 4th edition, this certificate of participation is presented to you.
Thank you, sir. Thank you. You're welcome. Number 3 is Elisha Government High School. Elisha, represented by Ajayi Favor, Obimunachi Cynthia, and the teacher is Mrs. Aojibe.
I want the picture to the right. So it should be this way. On behalf of the National Conference on Environmental Health, the 4th edition, this certificate of participation is presented to you and your school. Congratulations.
Thank you, sir. You are welcome. Thank you very much. Number 4 on the list is Oshogbo Government High School, Oshogbo, represented by Akintade Abdullahi and Ogunkola Ifeoluwa. The teacher is Abidogun Ehe.
On behalf of National Conference on Environmental and Health, 4th edition, this certificate of participation is presented to you and to your school. Congratulations.
Thanks for coming. Number 5, Unique Minds International College, Ilefe. Let OAU get ready, OAU International School. Unique Mind is represented by Ilesami Ifesami and Adebo Alesamo. The teacher is Mr. Omoniji, OA.
On behalf of the National Conference on Environment and Health, the 4th edition, this certificate of participation is presented to you and to your school. Congratulations.
Thank you, sir. Number 6, Obafemi Awolowo University International, Ile-Ife, represented by Lucien Bolu Atife and Osagide Ifosa. The teacher is Mr. Oyelade R.O.
On behalf of the National Conference on Environment and Health, 4th edition, this certificate of participation is presented to you and to your school. Congratulations.
Thank you, sir. Good on. Next is Orita Mefa Baptist Model School, Ring Road, Ibadan. Can we give them a round of applause? They came all the way from Ibadan. Orita Mefa Baptist Model School, Ring Road, Ibadan. Represented by Olayiwola Peter Akinropo and Father Olushola E. Mr. Oniti High is the teacher.
On behalf of the National Conference on Environment and Health, the 4th edition, this certificate of participation is presented to you and to your institutions. Thank you very much. Congratulations.
Thank you, sir. Number 8, Orita Mefa Baptist Model School, Total Garden, Ibadan. Orita Mefa Baptist Model School, Total Garden, Ibadan. Represented by Olowo Kere Gold and Akinwola Oluwasegun. Mr. Deyi Timothy is the teacher.
On behalf of National Conference on Environment and Health, the 4th edition, this certificate of participation is presented to you and to your school. Congratulations.
Thank you, sir. Number 9, Olufumi Miracle of God College, Ibadan. Omoto Shobolade and Rohim Karimat represented the school, and the teacher is Mr. Oshuolale high. Thank you, sir.
On behalf of the National Conference on Environment and Health, this certificate of participation is presented to you and to your school. Congratulations.
Thank you very much, sir. The last but not the least, Our Lady and St. Francis Catholic College, Oshogbo, Osco, represented by Olaguju Suzanne and Abioye Peter. Olukani OE is the teacher.
On behalf of National Conference on Environment and Health, this certificate of participation is presented to you and to your school. Congratulations.
Thank you very much, sir. Daddy, you still present the award winners? Yes, sir. Yes, sir. Thank you, sir. Now, so we don't take much time. After 5 rounds of keenly contested competition between the schools, it was keenly contested. Eventually, the Redeemers University Staff Secondary School, Ede, won the prize, and I will ask them to step forward for the award presentation. Incidentally, last year, Redeemers University went out in the first round. So I think they went to rejig themselves, and then they came to Loud.
I'm delighted to present this plaque to you and to your school for a job well done. Like I said, you went out first round last year, but this year you proved yourself to be worthy of this award. I congratulate you personally. And next time, Adeleke is going to be here too. Congratulations.
Thank you very much. Please, a round of applause for Professor Omi Shakin, and a round of applause for our quiz winner. Thank you very much. Thank you, sir. Permit me to lastly, before I leave, appreciate, I call him a passionate leader, who carried the burden, not just the finance, he carried the burden of how we are going to actualize this vision of reaching young children with the informations that are important on the environment and health matters. Please, a round of applause for the Executive Secretary of Osun State Health Insurance Scheme, Dr. Adeniyi Ogini, for his massive support morally. And permit me also to appreciate the Living Science Foundation for these thoughtful ideas, for the untiring efforts they put in, year out, to make sure we are doing our job. Please, a round of applause for Living Science Foundation, led by Professor Ojo. And lastly, for the team members that worked assiduously to put this competition and to make our mini camp experience a delightful one. I can't call their names, but I'd like us to appreciate them. A round of applause for them. Thank you very much. We will see you again next year, bigger and better.
Thank you, Dr. Oladimeji Babatunde, the coach of the Next Frontier. Every year, a special environment and health, individual or organization who has contributed substantially or significantly are identified and chosen among many. This year, we have the winner is the Waste Smart Green Project Foundation. And to take the citation we'll call on Dr. Femi Aluko to come and give the citation. Dr. Femi Aluko, sir, yes, you are welcome to give the citation for Waste Smart. Yes. Is Mrs. Ukutoyejo, where is she? Is she somewhere? Can she give us a... Mrs. Ukutoyejo, can you give us a citation for Waste Smart Growing Project Foundation? Mrs. Ukutoyejo, please, can you pass, if you are not available, please, you can... Okay, are you ready? Okay, come over then. Yes, we are waiting for you to come and take the citation for Waste Smart. Yes, you can just come to this side. Yes. Registrar of the university, in person of Mr. Olukayode, to come and present the award to the winner. Is always presented to an organization who has contributed significantly to the environment. So, sir.
So, on behalf of the organizers of this event, I'd like to present this to Waste Smart organization for the most outstanding contribution to sustainable development in Nigeria via the environment health sector in 2018. Congratulations. Congrats.
Thank you very much, sir. Right, I will go on straight to the keynote address right away. I hope we have Mrs. Secretary Joe stand by. Is she gone back again? Please, can you help me to call Mrs. Secretary Joe, please? She's gone back. I think she was here a few minutes ago. Please. Right, I want to call on Dr. Gafar Alawode, who is going to give us the keynote address. But before he comes up, I'll call on the person who is to recite the citation in person of Mrs. Toyin Ikutoyejo to come and give the citation. Apparently, I guess she's busy with the registration team. So you're welcome.
Good morning, everyone. I want to recite Dr. Gafar Alawode. Okay. Please, Dr. Gafar Alawode. Okay. Yeah. Dr. Gafar Alawode is an experienced public health practitioner and a seasoned program manager. He obtained his first degree in medicine and surgery from the University of Ilorin and master's degree in tropical medicine from Liverpool School of Tropical Medicine, UK. He was later awarded membership of UK Faculty of Public Health, MFPH, through distinction. He has managed several donor-funded development projects at senior levels in Nigeria and other developing countries. He was engaged by Merlin, a British INGO, as the project coordinator for DFID-funded MCH and primary health care projects in Liberia in 2006. He also managed ECHO and BPRM-funded health system strengthening projects and HIV and TB projects in his capacity as health coordinator for International Rescue Committee, IRC, in Liberia. He later rose to the level of country manager with Liverpool Associates in Tropical Health, LAT, in Nigeria, where he was responsible for program coordination and program development. He also managed Global Fund malaria projects that was supported 19 states in Nigeria as program manager. He was later engaged as a team leader for Kaduna State team of multi-million-dollar DFID partnership for transforming health system 2, which is part 2. He was chief of party for USAID, funded health finance and governance till the end of the project recently, and he is currently the program director at DGI Consults and chairs the Health Financing Committee of Health Sector Reforming Coalition, HSRC, of Nigeria. Among other accomplishments, Dr. Gafar Alawode conceptualized legislative network for UAC, the first of its kind, and mobilized other partners to operationalize the initiative. The initiative, which was designed to harness and align statutory roles of lawmakers to UHC goal, attracted membership from the National Assembly across the states of the country within 1 year of its existence. The network was responsible for inclusion of Basic Health Care Provision Fund in the 2018 budget, which translated to additional 54 billion naira for provision of basic health services. Dr. Gafar, standing here, he led evidence generation, multi-sectorial engagement, institutional repositioning, and domestic resource mobilization, which is called DRM, related capacity building efforts, which translated to more than 100% increase in health funding in more than 6 states in Nigeria, and more than 600% increase in HIV and AIDS response funding in Lagos State. He provided technical leadership and led high-level advocacy visits that resulted to establishment and takeoff of state social health insurance scheme, SSHIS, in 5 states, namely Cross River, Lagos, Kano, Sokoto, and Osun states. Dr. Gafar led technical design support on SSHIS legal framework, operational manual, benefit package, organizational development, and capacity building for staff. He also led evidence-based initiative towards health financing reform in Nigeria, Liberia, and Uganda. He led his team to conduct health financing diagnosis in the areas of fiscal space analysis, public expenditure review, governance, political economy, and public finance management. Dr. Gafar developed a diagnosis to action framework which helps stakeholders to translate diagnostic findings to action that will reform health financing landscape. The framework helped tremendously towards improved DRM for health highlighted above. Dr. Gafar led his team to institute multi-sectorial approach to health financing reform at the state level in Nigeria. The approach brought together actors that were hitherto not engaging each other under a single platform for meaningful engagement and shared understanding of areas of mutual benefit. He led high-level advocacy visits to more than 5 state governors that generated more political support for health in those states. At international level, Dr. Gafar led a team of other experts to prepare a policy position paper that advised 54 Commonwealth Ministers of Health on effective aid utilization and DRM through evidence synthesis. Lastly, in recognition of Dr. Gafar's contributions to health reform in developing countries, he was awarded a membership of United Kingdom Faculty of Public Health through distinction. This category of membership is only offered to those who are recognized as having distinguished themselves through their significant contributions to public health practice, policy, or research, or to the specialty of public health. Dr. Gafar is also a social entrepreneur, and he chairs the board of trustees of Network of Social Entrepreneurs, NOS, an organization that is committed to peaceful and prosperous Africa. He is married with 2 children. As I introduce Dr. Gafar.
Thank you very much. Thank you, Madam, for the citation. So, okay. So, good afternoon, everyone. And thank you very much for thanks to the organizer for inviting me here. I'd like to thank our medical elder, Prof. We are very, very happy and honored to have you here. The chair steering committee and the university. Earlier on, when Madam was introducing the Redeemers University, she said, Ife is great, and they want this institution to be great as well. But as far as I'm concerned, you are already doing great things. And greatness is defined by action, it's not a nomenclature. I would like to congratulate the university for the great work. My brother, the ES of the executive secretary of the State Health Insurance Scheme, Osun State, thank you very much. He actually brought me here and insisted I must be here. So who am I not to honor him? And our partner from the media, NCA, thank you very much. They said perception is everything. No matter how good you are, if nobody knows what you are doing, you are not doing anything. So I would like to congratulate this gathering for having this very, very important discussion and topic for the conference. And a lot of unique things in this conference, especially having the younger ones who will be the leaders of tomorrow as part of the critical discussion around environment. Though my topic is around basic care provision fund and its relationship implications for environmental health. But let me say this from the beginning. And I've learned a lot of new things in terms of for our environmental specialists, saying it is what you give out to the environment that the environment gives back to you. That's very, very key and strategic. Environment is very, very important to the extent that the global health agenda that we call SDG stand on a tripod. The first tripod is economic growth. You have to develop the economy. The second tripod is equity. And the third, probably the most important, is an environmental sustainability, which is very, very central to many other things. So I would like to go straight to the point. I was asked to speak on the topic of Basic Healthcare Provision Fund and the environmental impacts of it. But before I go into the details of what we are going to say, perhaps the narrative or what we say about the health system in Nigeria is about our health system is not catering for us. If you go to the health facilities, maybe the drugs are not there, or the health workers are on strike, or they are closed. When we get there, we are not able to get the needed service. That is the narrative I met when I was born. And that is the narrative I grew up with, that Nigeria health system is a very weak one. However, some people are of the opinion that even all of us that sit on this side from here, if that is the story we are used to, it shouldn't be the same for these people here. I hope you understand what I'm trying to say. Apart from the madam that's supposed to be here that is here, and a few people there. To ensure that going forward, the people here, the story they will be telling about Nigeria health system is different. Some people came together and say, wait a minute, what is the problem? Because if you want to solve a problem, you have to understand it. You can never solve a problem that you don't understand. They now look at what are the issues. Somebody should please help me to put on the next slide. I hope you are able to see these slides, right? That's where I'll be speaking from. Who is controlling it, please? Okay, thank you very much. So like I said, this is going to be the journey of my story. Though I have only 30 minutes, but I like stories in the sense that we have to understand what is the issue with our health system. Why are we doing the current reforms that we are doing? What is the Basic Healthcare Provision Fund, and what is the environmental impact, and how do we safeguard against the environmental impact of it? Next slide, please. So, if you can see this, forgive me if it is not very clear, but I think you can see some things. This slide is telling us about the current situation of our health in terms of what we want our health system to achieve. Is it achieving it? We set a target, MDG, Millennium Development Goal. We want to reduce maternal mortality ratio. Unfortunately, we are not able to achieve it. In terms of coverage of key services, we are not there. Services including contraceptives and basic services. Another chart is telling us out of children that are malnourished, how many of them are getting the basic services they need. And then the last one there is telling us rich people have better access to health care than the poor. But it shouldn't be. Wealth should not be the determinant of health, because all of us need help. So that is the picture, that if you want to see what is the status of our health today, health is not achieving what it's supposed to achieve. Because if the health system is working well, we'll be meeting our targets. Key services will be available, and wealth will not be the determinant of health. That means the system is malfunctioning. But stepping a bit further, next slide please. We want to find out that why are we having this picture? You know, the difference between all of us here and the Babalawo is that when you have problem, before you get to Babalawo, even before you enter, he knows what the problem is that not? But those of us here, we have to do what they call diagnosis. Even the doctors, the nurses and whatever, you don't just go there and they start prescribing drugs. They will find out, they will take history, ask you what is the problem. They ask you to do some investigation. So for people who have done investigation, and they discover that one of the problems with the health is that even when we have policy are good for the shelves, not implemented. And probably not implemented because of lack of resources. And that of lack of resources affects provision of services as well. And as a result of that, people that need services are not able to get it. So, money is very, very central. Where I come from, they say money is even the vehicle of the gospel. If you want to preach this gospel without money, you cannot do it. Money is very, very fundamental. And the countries that have made progress, where people are able to access the health care they need, government is spending more, but spending in a way that services will be provided. So, next slide. So if you look at how we are spending on health in this part of the world, we have a lot to do. If you compare ourselves, next slide please. If you compare ourselves with other countries that are having better health care, in part of the benchmark is that government should spend at least 15% of its budget on health. In Nigeria, we are doing 4%. And do you know what? That agreement was made in Nigeria. They call it Abuja Declaration. And even in Abuja, we are not obeying the Abuja Declaration. And many other benchmarks. I don't want to bore you with the statistics in terms of where we are not spending well. For countries that are making progress towards universal health coverage, government spend at least 5% of its gross domestic product, they call GDP, on health. In Nigeria, we are doing less than 1%. Are you now surprised that our health system is not performing? Because when you go to the market, and what your money can buy is a 2000 and under 86, for example, in terms of vehicle, or Mercedes Benz 200. That is what your money can buy. And you are now comparing yourself with somebody that is spending on BM 2018. So it is what your money can buy that the money will buy. But what is now important is that government says, what can we do to change this situation so that we will spend better on health? So in 2014, there was a law that was passed. They call it National Health Act, which is the legal framework for health. There are a lot of things inside that document. But what is very important to us today is Article or Section 11 of that document that introduced what they call Basic Healthcare Provision Fund. I want all of us to listen, especially these young ones, because that is going to be the game changer in Nigerian health system today. A lot is going on there. And what is Basic Healthcare Provision Fund? Is a special money that the federal government says in our budgets, at least 1% will be dedicated into provision of basic minimum package of care for all Nigerians. This is going to be the game changer. Basic minimum package of care for all Nigerians, whether you are from the north or south, east, you are Hausa, you are Igbo, you are Ibera, whatever. This money is set aside. So let me take you, and again, this is showing you that apart from the Basic Healthcare Provision Fund, government has a number of policy trusts, other policy in place. I don't want to go through the list, but there is decentralization of health insurance. Because government discovered that, how many of us have health insurance? If you have health insurance, raise up your hand. 1, 2, 3. This is nationally representative because you are not more than 5% of people that have health insurance. And if you look at Nigeria today, less than 5% of people actually have health insurance. So in order to make everybody have access to health through health insurance, the government decided to do what they call decentralization. That means each state go and set up a health insurance scheme. And that's why we have Dr. Ogini and his team in Osun State leading the health insurance scheme. So that later on, all of us, we have health insurance. And why is health insurance very, very important? Spending on health is different from spending on other things. We are in April. And most schools are on break now, right? We know in 3 or 4 weeks they will resume another spending on education. So we can predict that, hey, when Madam say, there is one wedding next week, we have to buy Ankara that worth 25,000. I say, remember April 29, my children are going back to school, right? And the same thing in September. You have to spend. What does that mean? You can predict spending on education. But who can predict the next time we will fall sick? Can anybody predict? Nobody. Aha. So if you cannot predict when we fall sick, and it can be like God save you if you fall sick on like 15th of the month or something. When the next salaries are several days ahead. But because we want some financial protection, and the reason why some people develop complications of diseases is because when they have conditions that are treatable, that are preventable, they are not able to go to the hospital at that time. If I have hypertension, if I have diabetes, if I don't have money to go to the hospital, probably the next time I will go is the emergency that will receive me. Because of stroke, because of complications of diseases that are not taken care of. In order to reverse this trend, government say, let's everybody have health insurance. So that we will not be thinking of health, money on health at the time you have the condition. And many other, whatever. So let's dive deeper into the basic care provision fund. So this basic care provision fund, government say, in order to have, sure source of funding, let's commit 1% of the federal government budget to basic care provision fund. Let's pull the money that donors are spending as well. Let's put it in the fund and other sources. Bring the money together and spend the money on 3 things. One is to spend the money to fix our health facilities. Remember, it is the health facility that is healthy that can give us health. Do you understand that? Health facility that is healthy, that the infrastructure is good, the equipment is there, the health workers are there, that can give us services. That can give us not only services, quality services. So 45% of the money will be spent on that nationwide. But it's not enough for services to be provided. Somebody has to buy the services for the people. Half of the money is going to that. And again, 5% of the money is reserved for emergencies, medical emergencies and health security issues, outbreak of diseases and all those stuff. So next slide. So in terms of where we are, unfortunately this is, I don't have a very big skin that is very close to you. This is telling us where we are. I won't spend too much time. Those people managing basic care provision fund, they said states has to apply. And today 22 states have applied that want to be part of the basic care provision fund. And because we are very smart in Osun, Osun is one of the states that selected first. Won't you appreciate Osun State? Osun State is one of the 3 states where basic care provision fund will be implemented. They've gone through everything, almost everything is already in Osun. What Dr. Ogini is waiting for the money to hit his account. Big money coming to Osun State to provide health care as services. And Dr. Ogini, please, as part of your basic care provision package and everything, let's prioritize these brilliant chaps, please. Let's start with them. We are already used to not, but let them start the new life and other stuff. So, Osun State is almost ready. And many other states, we hopefully, the money will hit their account. Next slide, please.
So I don't need to spend too much time on this. It is how the money will flow. They have what they call operational fund money and the program money. Program money is the actual money that we are going to use to buy services. Next slide, please. So like I said, the operational money. Next slide. Now, what is going to, because this is the conference on environment and health, what is the implication of this additional money coming to the health system? What is going to be the implication on the environment? So there's a document, they call it Operational Manual for the Basic Care Provision Fund. It's an open source document. I want all of us to have access to it and read the document. It actually talk about what is going to be the impacts of the Basic Care Provision Fund on the environment. To start with, he said, Basic Care Provision Fund will not involve a lot of constructions that will have its own impact on the environment. But having said that, somebody should help me to click, to just press on the next button. Just press. You see, something is happening there. We are going to accumulate more waste. Additional waste generation as a result of increased service utilization. It's almost normal that when more people come to, people that have not been coming to the hospital before, now all of a sudden they know that a set of services are free, so they are not coming. In the process of doing that, we are going to generate more waste. It's going to have implication on our environment. But having said that, no, previous slide, I'm not done with that slide. Having said that, the document is very proactive in terms of how we are going to deal with. How many of us are aware of our national health waste management policy in Nigeria? Even those of us in white, that is what they call National Health Waste Management Policy. You see, part of the problem is that there are a lot of policies that are just enjoying themselves on the shelves. One of the reasons is that we don't have money to implement them. That's why some of them are enjoying themselves on the shelves. So what basically, and that document is a very good document that clearly identifies what are the medical waste in Nigeria. What is the source of medical waste? How do we deal with medical waste? So Basic Care Provision Fund is telling us that that document is going to guide us in terms of how to manage the medical waste that will be coming from additional waste that we are going to generate in terms of implementation of Basic Care Provision Fund. Because a facility that does not get up to 50 consultations in a month and is now having 250 consultations, definitely we are going to generate more waste. And we have to be very, very careful in terms of how do we manage this waste. Because if you don't manage waste, the money that you are spending to buy health, you might be spending that money to buy more diseases. Dr. Ogini, am I correct? If care is not taken. So what are we going to do? Next slide. The document is very, very clear in terms of what are the immediate steps that we need to take so that we are going to do this. First, the documents identify possible environmental impact and mitigation. Very, very detailed. And those of us that are environmental practitioners, please, it's very, very important for us to have access to it. That what is going to be the source of problem or impacts negatively, it is identified, and identify the mitigation as well. But two, like I said earlier on, it's not that we don't know how to manage waste in most cases. But the funding for it, Basic Care Provision Fund, has a positive implication on waste management in health facility, because part of the money going to the National Primary Care Development Agency that will go to the State Health Insurance Agency, State Primary Care Development Agency and the facility, part of the money could be used to manage the waste management infrastructure at the health facility. So providing funding is one way that Basic Care Provision Funds could have implications on waste management and environmental impact mitigation. Again, the document is talking about Air Care Waste Management Plan by HCWM, I mean Air Care Waste Management. There will be a plan. Later on, we'll be looking at who is responsible for developing this plan, who is responsible for implementing it. Then, Air Care Waste Management checklists. That before Dr. Ogini starts Basic Air Care Provision Fund in a facility anywhere in Osun State, there's a checklist that will be administered. That, do you have this in place? Do you have this in place? Before you start generating more waste, what is the structure that you have to do this? And I want you professionals to be highly involved. Then another thing that Basic Care Provision Fund did is to define roles and responsibility in terms of managing medical waste that is going to be generated as a result of the Basic Care Provision Fund. So let's look at the roles and responsibility. Next slide. Now, before I go there, something that I did not mention is the structures responsible for managing Basic Care Provision Fund. At the national level, we have the National Steering Committee, chaired by the Honorable Minister. We have relevant agencies there. At the state level, we have the Honorable Commissioner chairing the State Steering Committee, where we have people like Dr. Ogini and the head of the State Primary Care Development Agency. These structures play a very, very important role in anticipating and mitigating environmental impact of the Basic Care Provision Fund. At the national level, they anticipate and mitigate impact of environmental implications of Basic Care Provision Fund. At the state level, the State Steering Committee is responsible for that as well. Anticipate, mitigate the impact of, then to coordinate the process. Abuja is responsible for coordination nationwide. The State Steering Committee is responsible for coordination of the environmental response to the Basic Care Provision Fund. And they ensure that, because, you know, Dr. Ogini and this whatever, they are very powerful on the State Steering Committee. They approve plan for spending of this money at the state level. And at that level, the Secretariat for State Steering Committee has the power to say, in your plan, you did not include activities on environmental impact mitigation. Very, very important. Next slide, please. Okay, so roles continue. The National Secretariat of the Secretariat of the National Steering Committee again ensures that there is proper reporting of the environmental implications of the Basic Care Provision Fund. And at the state level, you know, earlier on I mentioned Healthcare Waste Management Plan. The State Ministry of Health and the State Primary Care Development Agency, they are responsible for developing and managing this plan. Then I mentioned a checklist. PAC department is going to be responsible for administering the checklist on the health facility. Then our ward committee will do supervision. But what is actually disturbing a bit is that document did not mention the role of the professionals in environmental health management. And you have a very, very, very important role to play in developing the plan, in managing, in implementing, in doing the quality assurance, so that we have a healthier and safe environment. But outside the Basic Care Provision Fund, honestly, we have to do things differently. Our environmental health professionals need to do more and be more involved in policy making around health. Let me give you an example. It's well documented that poor people are likely to have access to bed net and sleep on bed net for obvious reasons, due to mass distribution of bed nets, and they are the one that they are rich, and very rich people like Dr. Ogene are not care. But that's not the point. The point is that despite the fact that the poor people are likely to sleep, have bed net, and sleep on bed net, their children are more likely to die of malaria more than the children of the poor. What does that tell you? To me, in my own little way of reasoning, is that when we are designing health intervention, we are very, very myopic in terms of what interventions should be. We look at very, very narrow set of intervention without taking care of environment. Now, it is easy for government to distribute bed nets than to put policy in place to pick all those sachet water bags and all those stuff like that, which are the breeding space for mosquito. So you professional here, you have to be part of all the policy around health. If we are environmental health specialists, there are a lot of policies that if we take care of the environment, we are going to mitigate, we are going to prevent very, very well in a better way. So please and please, I would like to use this opportunity to thank the organizers of this conference, especially the university, because globally that's the work of the university. It's unfortunate that there's a big dichotomy between the academia and the society. And you are leading the way and showing the way in terms of how things should be done. We have to bring the policymaker, the academia, and the policymakers together on a continuous basis to discuss how the issue of environment affects health, what is the status of implementation of the policy, how do you interact with Dr. Ogene, for instance, on basic care provision fund to ensure that environment is protected. I think it's a very, very important issue that we need to look at on a continuous basis. Last slide. So my last slide is just thanking you. I'm not only thanking you for listening, but I'm thanking you for making our environment healthier and safer. Thank you very much.
Thank you very much, sir. Please, another round of applause for the keynote speaker. Before we take the question, we do the interaction with the keynote speaker, I want to recognize the presence of the former, he chaired the conference last year. He's in person of Professor S.R.A. Adewusi, a retired professor of chemistry at Obafemi Awolowo University. Also member of the editorial board of Nigeria National Journal on Health and Environment. We also have Professor Falade also here present from Obafemi Awolowo University as well. We have Mrs. Modukbe Adebajo, a deputy registrar of Obafemi Awolowo University also. She's here. We have, thank you, you're welcome. We also have Dr. Abiye representing Professor Babatunde Rabiu. You're welcome. We have Professor Mrs. Beatrice Ogumba also here present. You're welcome, man. Thank you for coming. Right, the keynote speaker has done justice to the topic. Now, it's time to ask him questions. So if you have questions, we should take 4. If you have questions, please, let's see your hands up so that, okay, thank you. 1. Another person? 1. Is that the only one? Okay, maybe I should call on Dr. Aluko to come and ask his question.
Thank you very much, sir, for the wonderful presentation that has identified and showcased the various challenges and how we can do things better, especially as implementing this program is concerned. I was at a program last week where we were also looking at the National Health Bill. And then a medical doctor made a presentation, and at the end of the day, I said, if I am myself as an environmental health officer, if I'm supposed to do the presentation, what I will present will be totally different because I'm going to look at that from what environment and net perspective. And ditto also, I was at a program organized by WaterAid in Abuja in January, talking about channeling a way forward for a better environment in Nigeria. And the Environmental Health Officer Registration Council of Nigeria was never represented. So we're beginning to look at some of these anomalies. Now, you also corroborated that by saying that, yes, we are going to look at the National Waste Management Policy. And of course, environmental health officers, the profession was not adequately represented. And when it comes to implementation, they are saddled with the responsibility by policy and by law of the Federal Republic of Nigeria to anchor, coordinate, and direct affairs as far as that is concerned. Now, how do we now look at this in terms of implementation? Because they will be held responsible, we will be held responsible at the end of the day for any malady or malpractice associated with poor management, especially of healthcare waste in Nigeria. As far as this program is concerned in the state, how do we now ensure that some of the anomalies we have identified are not clogged in the wheel of safe implementation of this program in the state? Thank you very much.
Okay, next, okay, sanitarian, Hakumi.
Yeah, thank you, Dr. Laode. Basic Health Care Provision Fund. It has been mentioned years by years. I wouldn't know how far have you gone. In Yoruba land, this has been mentioned year by year by year. Ogini has been there for years, even before Dr. Ogini was appointed, yes. How far, sir, and how long? Is it when, I don't know, because the planning has taken more than 5-6 years. You told us now the fund is coming. When will the fund be arrived? Thank you, sir.
Thank you, sir. Yes, sir. Come.
My name is Yemi Arowolo, Director of Admin and Supply of Sweat Insurance Scheme. I know Dr. Gava very well, and I'm not surprised with what he has given us this morning. Now, my question is this. You have talked about how we are going to factor in the sanitarian so that to prevent the diseases. Because if they have been doing their job very well, then the disease will be reduced. Thereby, we will not be spending much money on health. Now, the sanitarian said the other time when he was giving his keynote address that before we used to see them moving from one house to another, doing the job. Then he termed me as intimidation. And that time he said the fear of sanitarian then is the beginning of wisdom. They will have been continuing in that manner. For example, even this environment here, let us go to this, what's the name of this place now? Akoda. Out of, I can say 98% of the houses here don't have toilets. And all they do is to just go to the nearby bush. And they have been spoiling the lands that the government reserve for the civil servants. And even the primary health center here, if you go there with your malaria, they will add more malaria to you, or even another disease. I don't know how they are now doing it, and I want to know how we are going to factor them in to do this kind of a thing. Thank you.
Thank you very much, sir. Up with the questions, we don't have any more questions. Okay, yes, sir. You're welcome, sir.
Yeah, good day, sirs. It's Isijan Nkanta from Lesra. Sir, from your wealth of experience, can you share more light on how environmentalists, especially the regulators, can have access to more funds from the local and international communities to fund some of the projects, especially at state level? I know that your scope was actually in the health sector, but can you tell us how we can have more access to funds to fund environmental projects? Thank you.
Thank you, sir. Okay, we have one student. Okay, please come. Now we take it as the last one.
Sorry, good afternoon, sir. Sorry, I just want to ask, I am Obunode Elvis, physics department. I just want to ask, when the form arrives, as a student of Great Redeemer University, how can I benefit from this health insurance? Thank you.
Thank you, sir. You can respond to the questions now.
Okay, thank you very much. That's why I like coming to Osun State, because is it still state of Osun? I want to know whether the change of regime has changed the nomenclature of the. Is it the state of Osun or Osun State?
Well, they said the State House of Assembly has actually confirmed the change to state of Osun. So officially they call it state of Osun.
Okay, thank you very much. I just want to be politically correct. Thank you. So these are very important questions that you've asked. And the first question is around representation. How do we ensure that the environmental health specialists are well represented in policy making and policy implementation? You know, the essence of having umbrella body of a certain profession is to protect the interests of the body, one, and again to let people know what they know that other people don't really know. That's the essence of having different professions. Otherwise, all of us will have been doing the same thing. That's the essence of specialization. I think the professional bodies need to play a very important role. One, to find out what are the existing policy trusts. What are the existing policy dynamic that government is bringing already in existence that the representation of the professional body is weak? We have to do that mapping. What are those existing laws that government is making now? There are a lot of professional bodies. They play a very important role in lobbying the House of Assembly, in introducing certain policy laws, and they form formidable parts of implementation. But you have to know what is happening. You have to know what should you contribute, and what is the platform for doing that. Let me give you a specific example with regards to the Basic Care Provision Fund. I told you there's a steering committee. What does that mean? They are steering. They have the steering in their hand in terms of how Basic Care Provision Fund is managed. Your professional, as a professional body, we should be part and ask them questions as it relates to environmental health. Again, part of what we are doing to ensure transparency, to ensure everybody knows about key policy trusts. On Basic Care Provision Fund, for instance, we've engaged the Federal Ministry of Health to ensure there is a monthly webinar. Webinar is an online platform where there will be, have a meeting with the Federal Ministry of Health. Like, for example, on Thursday, there's going to be one where the Federal Ministry of Health will give updates on implementation of Basic Care Provision Fund. And from any part of the world, as far as you have the link, you can call and ask questions. You can call and ask questions about the environmental health aspect of it when the implementation starts. So these are some of the few ways to raise the profile of the professional body to be part of the key policy making. You have very, very, very important role to play. One of the reasons why our health system where we are is because a lot of professional bodies are not effectively engaged. And I tell people, I'm a medical doctor, but health work is a teamwork. It's like a football. You cannot say because you are a very good striker, you don't care whether your goalkeeper is sleepy or not. You can score, but they will score many against you. So we have to look at this team spirit, working together, and I'm very happy with the leadership in Osun State, where all of us are working as a team. Now, it's a very good question about if we use 10 years to prepare for madness, when are we going to full-blown madness? That's my own interpretation of that proverb. So you're absolutely correct, and a lot of people almost gave up with regards to the Basic Care Provision Fund. A lot of people before our time in the health system, they did a lot of work to ensure that the law is even passed first. After passing the law, it took a while before the then president assented to it. At the twilight of his administration, that was when he signed. Let me sign, let my name be there, and all the stuff. So when he signed, and like I said, money is the gospel of money is the vehicle of the gospel. They did not put the money in the budget since 2014. All the civil society, they came together, please put the money, they did not. Until last year was the first time, after a lot of pressure that we placed on the National Assembly, they put the 1%, 55 billion naira in the budget for the first time. But all of us, we thought, oh, by the time we have the money in the budget, the money will just be flowing. We never knew we were wrong. There are a lot of obstacles. The Federal Ministry of Finance said, where is your operational manual? We cannot give you this big amount of money because we are not sure of how you are going to spend the money. Then the health sector actors will put together a manual. And then when we put together a manual, the NHIS now says, no, the content of this manual will only favor the Federal Ministry of Health. The National Primary Care Development said, no, the law says we are responsible for developing this, whatever. After scaling the first order, then, interagency rivalry and all those stuff. Later on, we were able to overcome that. Now, all the agencies agree and they signed the money. Now, for the money to start flowing, another set of obstacles, they said, no. And who is going to be the signatory to these accounts? The Federal Ministry of Finance said, no, those people like Ogini, they are not accountants. We need accountants to be signing this. But all those things are part of the, unfortunately in this part of the world, part of the teething problems, which the good news is that 15 billion is already in account in Abuja, not Dr. Ogini's account, so that people will not be calling him. At Abuja level, part of the money. And yes, this money just gave me a good news that we're able to scale another order in terms of who is going to sign and all those stuff. In life, whenever you want to do something that is going to be very successful, there could be a lot of hiccups that we have to, but we are hopeful that we have done all the preliminary things for madness. The next thing is to go to the market now, and that will be done. There's a question around status of environmental health facility, houses not having toilets, even access to water and all those stuff like that. I want to believe it's a very important question you've raised. An environmental problem is a very complex one that require, you asked the question, I hope you are listening, that require political commitment. And somebody talk about the issue of how do you assess fund. Let me answer the two together. The single most important source of fund to take care of that is government funding. Why do I say that? If a donor organization give you money this year, they give you next year, you can't be so sure that the third year the money will come. And through program like Basic Care Provision Fund, we can see that how do we take care of, even to start with in the health facility, how do we ensure that our health facilities are healthy to start with? You mentioned an important point. The reason why the Ebola was very bad in 2014 in Liberia and Sierra Leone, do you know why? because of lack of access to water in health facility. Health facility that's supposed to be a place of health now became sanctuary of infection. You go to the health facility, malaria take you there, you come back with Ebola. So the issue of a fund, and it's a multi-sectorial approach, the issue of sanitation, that we have to take seriously. One of the reasons why people look at diarrhea, simple sanitation, simple access to water. Somebody was telling me that when he was growing up, you know, they used to tell us that when the child gets to a certain age, they must have diarrhea. We never knew it was poor sanitation. We thought it was just normal. He was now telling me recently that I have like 6, 7 years old. They've never had diarrhea for once. I said, where do you stay? You have running water every now and then, good sanitation and all those stuff. That's why they are not having diarrhea. So, again, a lot of people are talking about how do you go beyond health intervention to take care of health. They call it social determinants of health. Where do you stay? Do you have access to water? Good sanitation. All of them have implications. So, in terms of points, environmental, whatever, are you part of it when Ministry of Health are developing their state strategic health development plan? You are not part of it. So how do we ensure that all these important points are there? If it is only doctors that develop policy for you, doctor will develop policy based on what happened in the health facility. Because they are not trained like you to understand real environmental health issues. So we have to work together like a team, coming back to where we started from, in terms of solving some of these problems. Then another brilliant question from a student. How do we ensure that a student of Redeemer University, before Dr. Ogini leaves, I think by the time they start their program, they want to enroll everybody. The good news that the law that set up the state health insurance scheme makes it mandatory. That it is mandatory for everybody to participate. You enroll, they can have special program for student university to capture the enrollment when it is convenient and all those stuff like that. But I'm very sure they'll have a special program for the university, whatever. And who says that at the level of students, you cannot be part of, and that's why I was very happy when they brought this. To know about policy issue, your students' union, you can interface with Dr. Ogini to make a special case. You know, I don't know whether you have student union here, but in those places where we have student union, those are the things they are supposed to be doing, interfacing with the relevant authority to ensure that the interests of students are actually protected. I think I've answered almost all the questions, but if there is anyone that I missed out, I don't know if here.
There's a reaction to one of the responses.
Okay, great.
Thank you, Doctor. We appreciate you. That question number 3 asked by one of the directors from Osun Insurance Agency. Let me say this, sir. Just like you mentioned, health program is a teamwork. Where it is lacking, it is a problem. If you continue to do it the way we are doing it, we are going to get the same results. Absolutely. To my director who asked the question, if a house is planned or drawn by a town planner without toilet, whose problem? Whose fault? He has mentioned Akuda. I want to say with due respect that in Akuda, more than 70% houses in Akuda has no plan or having plan without toilet. In the olden days, when a house is planned, if a draftsman or a town planner draw a house, it has to be monitored by environmental officers. Now it is done alone. Let me give you another example, sir. Also, State Primary Health Care Board. The law was passed without inclusion of environmental health department. And the federal ministry had included, at the federal level, they included that department. When it was done in Osun here, the department was removed. Now ask that question. Who is going to take charge of, when you look at the primary health care component, the environmental health officer has 3 key components to handle. And when the profession is totally removed from the bill, who will do the job? Like I said during my goodwill message, let me repeat. I am an environmental health officer, sir. I have my first degree in net education. I have 2 masters in environmental management and control. I have my PhD in public health. Who can do it better than me in that field? Just like you mentioned, you now put another professional there. Tell me, what can that person do better than I do? Now, the question now comes that Akoda, which he used as a very good example, as Akoda got in a dump site, in Yoruba land, they will say, do we have a dump site in Akoda? Has government done anything to have a dump site where we have workers' village? Owode is very close here. Owode is the next London of Osun State. Owode is here. Do we have any plan to have a drainage in Owode? Do we have a dump site in Owode? How would you have an environmental problem there? So what we are saying is, there is what we call the global best practice. You cannot ask me as an environmental officer to intimidate the public. They must listen to me. I must make friends with them. I must be able to educate them in such a way that they put into practice to change their excreted habits. But if they see me in the public and they run away, what would they do? Sir, in 1991, I was a student in Oshobo, and we approached a very rich man. Baba, you must provide a toilet. He said, I didn't have money to provide a toilet. You are a very rich man. We took him to court. The court action says, provide a suitable toilet within 2 weeks. This Baba provided that beautiful toilet, very beautiful, within a week, because he has money to do it. And whenever you get to his house, I say, Baba, where is your toilet? And toilet, Baba, this toilet is too fine. He said, you said you coerce me to provide a toilet, and that is your toilet. Baba, you are not using it. He said, in my family, a son should not defecate on his father's feces. Because we coerce him to provide a toilet, he doesn't know the meaning of having a toilet. We just have to educate Baba. Baba, don't worry, nothing will happen to your son and yourself. After 3 months, he accepted. He obliged to our request. After 7 days, nobody died. After a month, nobody died. He said, we want to celebrate us. When that was 1991, he gave us 200 naira. You know how big, how weighty 200 naira was.
Did you declare it then?
So all I'm saying about the fear of environmental officer, it was in the olden days. Don't fear us again. Let us talk together. Let us discuss. You have to know the importance of having a good environment. Environment, like I said the other time, is like a computer. Whatever you garbage into the computer, it garbages out. Whatever you garbage into the environment, it goes back to you. What I'm trying to say is, we are into best practices. I have to discuss with you. I have to tell you the implications of what you are doing. There must be a change. Health education is the heart and science of giving simple, accurate, and scientific information on health in such a way it could be believed by you, put into practice to change your excreted habit. Thank you.
Great. Sorry, do I have a minute? A minute, please. So thank you very much for sharing that wealth of experience. Very, very useful. And for all of us, what you said. Health. The town planners need to be very, very important to work with them. Ministry of Education, we have to work with them. Ministry of Finance is a whole government approach. One of the reasons why we're having issues is that we have agencies that are working in silos and not working together. Let me give you an example, away from environmental health. Every March, April, in northern Nigeria, meningitis killed a lot of people. Do you know one of the reasons? Go and look at the type of houses people build. Look at the window. No ventilation. And I was asking myself, is anybody in Ministry of Health talking to the Templars to enforce certain building standard to ensure that people have good ventilation that will minimize the impact of meningitis? The same thing applies to the issue of environmental health. When people build houses and developer go there and they mark the whatever, they will stop the construction 2 days after they will start. And they are continuing the same thing. And the question is that if you're actually working together, we'll be able to mitigate a lot of this. I don't know of Osun, but in my place, the issue of water is a very big problem. When I was growing up, we used to have water from the waterworks. But nowadays, everybody is now the waterworks in his own house. But what are those people that are not able to even dig holes, dig wells, a borehole, or whatever? Where would they get the water? And how is the environment going to be clean if there's no access to water? So, multi-sectorial action is very important. Working with the waterworks, Ministry of Finance, Ministry of Health, and town planners. I think, sir, it could be part of the communique from this multi-sectorial approach to environmental health. Thank you very much.
Thank you very much, sir, for the interactive section. Before I call on the chairman for his closing remark, I have 5 minutes, and I just want to make the interaction a bit rich. And I want to call on Dr. Aborishade to make his comment.
Well, thank you. Well, I must say that I enjoy your lecture. It is a good lecture. And it's unfortunate. Our honorable has gone. So, but I believe people are here to pass the information to him. In 2003, I went to Accra for a conference. And let me say thank you to Professor Adewusi because the decision was taken in his office together with late Apu Akwe. So, and I got to a checking point that's inside Ghana. Then I discovered that checking point, female are going this way, male are going this way. I was wondering, I tried to, as one sir said, one person, maybe they are going to collect a document too, so that I will know. I asked the person, what are they going to do there? He said, at this checking point, everybody must get down. No matter how influential you are. And they know people will be pressed. They will like to go and wee or to go and poo-poo. They have made provision for the male and made provision for the female. But I know if I have to be in Nigeria, you are going to see a big signboard. Do not urinate here, but no provision for things like that. My advice is all these things that the law that we enacted, proposed and everything, we should look for the practicability of it. The law that will work. So the man that left here was saying that there is no dumping refuge and place like that. I think when we are doing the law, we should take those things into consideration. I discovered Nigeria, we are law abiding. But our leaders, you are the one encouraging us to break the law. Please help us. Thank you.
Thank you very much. So I'll call on the chairman. Okay, you still want to make a comment, sir? Okay, let me give you I still have 2 minutes. Okay, let me give you. Okay, all right.
Thank you very much. I am pharmacist Sumono Lasukami from Health Insurance. I enjoyed my brother's presentation the other time. And what I believe is that you have a union. You have leaders in that union. You pay your dues. All what he was saying, I can see it as a form of laxity on the part of your leadership. If you are supposed to be in a place as a very key player, especially in primary health care board or that agency, and you are still keeping quiet up till now, then it means you people are lazy. Use every weapon available. Militancy is not a prerogative of anybody. Because your absence there is making the agency very non-functional. And the House of Assembly is there. You can take opportunity there. There are so many opportunities. But I want to ask a question. The Director of Planning for that primary health care board is from you people. Am I correct? Because I know that I don't want to mention him. But please, going from here, this place can be an advantage for you to wake up and claim what belongs to you. Thank you.
Thank you very much, sir. So I'll call on the chairman for the closing remark. Professor Omishakin, you're welcome.
Thank you very much for this opportunity. I believe we've learned several things from the presentations, not only from Dr. Lawode. What Dr. Lawode covered in 30 minutes, we take a whole year to cover it in the classroom. So you have to give him hands of applause, please. Thank you very much. Because for we teachers, we know what it takes to teach that kind of class. Also, the other presenters did very well. Those people, the sanitarians, and the students, some of them that are remaining. We thank you very much for participating in these activities this morning or this afternoon. There's one observation that I have to make. What I observe in Nigeria, we the so-called experts, we think that we know what the community needs. We'll tell them, oh, you need water, you need road, you need this. Do they really need all these things? How do we arrive at this? Because we know we call ourselves experts. We need to get community involved in whatever we do, especially in healthcare system. And I know the sanitarians they're closer to the community than any other groups. The academicians always think that they know everything that the community needs. So we have to go to the community and tell them this is what you need. But now we need to work with the community to assess their needs. In other words, diagnose their problems and come up with solutions with the community. Because here in Nigeria, everything depends on government. You say good roads, that's always the job of the government. Water supply is the job of the government. This is the job of the government. But when you ask people to pay tax, they say, well, I didn't make anything last year. How can I pay tax? And the government has not done anything for me. Why should I pay tax? The community can work with the so-called experts to solve their problems. Nobody wants to live in a dirty environment if they understand why they should not live there. It's because they don't understand it. We have to educate them to let them understand why they should not live in a dirty environment, why water is important, why good sanitation should be maintained. Once we are able to educate public and we get them involved from the beginning, not we going there and telling them, they will work with us, we as health professionals. Once again, I thank all of you for your patience. And I thank Dr. Lawode one more time. Thank you very much. This is the end of my role here. Dr.
Thank you very much. Please give the chairman a very warm round of applause. Our host in person of the registrar, Mr. Olu Kayode Akindele, has requested that anyone that wishes to see the African Center of Excellence for the Genomics of Infectious Diseases should let us know that there will be a tour to that center so that you will take you around and then you can have access to the facilities and also interact with the members of staff, the lab manager there at the end of this section, at the end of the second session. Right now, we are going to, just before we go for the break, I want to let us know that there's a second session just immediately after the tea break. We're going to have the impacts of air pollution on human nutrition and health, to be delivered by Professor Babatunde Rabiu. And the other one is breast milk, the environment-friendly source of perfect nutrition for infants, by Professor Beatrice Ogumba. So we have those two just before they will go for the lunch. And so I want to invite Dr. Aluko for his vote of thanks. You're welcome. Please.
On behalf of the Living Science Foundation, we want to appreciate our host, a wonderful host and collaborator as far as the National Conference on Environment and Health is concerned. That's the Redeemers University, ably represented by the registrar. We appreciate your support, we appreciate your kindness, and we appreciate your effort in advancing the cause of environment and health in Nigeria through this program. Permit me to also recognize the chairperson for this session, in person of Professor Umi Shakin. He was my mentor while growing up. I wish to be like him. And then when I published my second paper in the Journal of Environment and Health US, he sent an email congratulating me and my mentor, Professor Shida, for a job well done. We were looking up to him. He's a professor of professors, a teacher of teachers, and he's still actively contributing to the development of public health in Nigeria. Sir, we are well appreciated, and we still wish you more strength to your entire biological system, sir. Also to the co-chairman who is absent, that's the Honorable Chairperson in charge of environment at the State House of Assembly. We appreciate his presence. We also appreciate his contribution and also the advice that he has given to us before he leaves. We wish him well in his endeavors and further contribution to the development of environment and health sector in Nigeria. We want to appreciate all goodwill messages given by NESRA, given by Osun State Health Informal Insurance Scheme, given by the Environmental Health Officers EOAN, that's the Environmental Health Officers Association of Nigeria, given by Nigerian Television Authority, and all other presenters who has given the goodwill message and the welcome address for this conference. They were well taken, they were well noted, and also adequately appreciated. Now, not also looking at every agency here represented, every person here seated, for your patience, for your contribution, for your support, as much as possible to this program, not also forgetting the kind contribution of the sponsors, especially the Osun State insurance scheme, Osun State Health Insurance Scheme. I also want to sincerely believe that Wash in Healthcare Facility is also part of that plan, which will also see the light of the day when it comes to implementation. On behalf of the conference organizers, I want to say thank you very much to all of us. And for those that will be leaving us at the end of this session, I wish you journey mercies. Thank you.
Thank you very much, Dr. Aluko. Please, I want the tags are available at the registration stand. So once you are after this session, you can go and pick up your tag. The tag will be used to pick up the book of abstracts, which is on its way. So will meet us. And also note that the meal ticket is for the lunch. Just keep your meal ticket for your lunch. You will use it to pick your lunch. And I'm going to invite Dr. Femi Ayoade for the closing prayer. Yes, before they will take the national, the university anthem, and then we go. And then also, immediately after the prayer session, we'll take the photography just in front here. Just we'll come to the front here for the photography. All of us, and then also we can interact. We've learned that networking is also very important. So it's also a time to network as well. Please make use of the opportunity. Because these people, you might not get to see them, as cheap as this. Sir, you're welcome for the closing prayer. Please, let's rise up to thank God for a successful opening ceremony.
Let us pray. In Jesus' name. Father, Lord, we thank you. We thank you for this gathering. We thank you for all the deliberations. We thank you for the facilitators. We thank you, O Lord, for all the deliberations today. Father, accept our thanks in Jesus' name. This wealth of knowledge, we ask, O Lord, that it would transform into actions that would lead to better health in Nigeria in the name of Jesus. Thank you, Lord, because you have answered. We commit the rest of the program to your hand. Father, take absolute control. In Jesus' name we pray.
Thank you, sir. Let's take the anthem before we go for the group photograph. Can we have the anthem, please? The technical team. Let's okay. Thank you. Please, let's come forward for the photograph. Let's come just on the stairs there. We can just arrange ourselves as we take the photograph. Okay, let's take the members of the I table first. Let them take their shots first. The members of the I table, members of the Professor Adewusi, please join them. Convener, okay. Yes, please. Sir, conveners, sir, please be beside mommy, the chairman. Sir, you are supposed to be in the middle. The convener, please, can you go beside the vice chancellor? Yes, sir, yes. Thank you. Nesria team, please get ready. Nesria team, you are next. Please get ready to join them. Nesria. OHIS, please, you are next. Please wait on standby. He will be calling you next. You can just stand on the stairs. On the stairs, please. You can just, exactly.